GRE. I want to tell you this GRE and TOEFL are waived for MBBS medical degree holders. You know, you have to deposit $200 for GRE exam because we have got the exemption for you for GRE, so you save $200. You are also exempted from TOEFL, so you save another $200 for TOEFL. Now the question comes about the SOFAS application form. So first go through this and you will find a bit, it will look like lengthy, but have patience. If you can take a screenshot of this form and then fill it up comfortably and take it easy, you should be able to fill it up. First, but find out what are the information required by it. That's important. So that's how you do. They might ask you to pay a fee of $300 and another $150, so $450 for completing SOFAS application. Once the application is found completed, it is sent to Johns Hopkins admission office. There is a joint admission committee that will review your application, and if you are found suitable, then you will be conveyed about the decision about your admission. Now coming to this $450 or $400 business. So this TOEFL and GRE we got waived. So what you have to do is you have to pay now $300 for credentialing of your documents. You see, you need a transcript. You have to send your documents to WES. What is this? Is World Education Services. WES. We will send you the email ID and the link for WES. So you have to upload your documents on WES site, and they will do credentialing and equalization with the other degrees in the world. If this is equivalent, then they will consider eligible, otherwise they will drop it. Okay. Now the question comes, the money you have paid them. So Indian rupees, this is $21,000. This is not a small sum. I know people stop filling up this application form, but what I want to say, IIHMR will pay for you for SOFAS application, but we cannot directly pay to SOFAS. You submit your application to SOFAS, give us the receipt, and we will reimburse that amount to you in your bank. So that's how we can save your $300 again, and that will be met by IIHMR University. So I would encourage you to complete your application. Don't get disheartened. The important thing by doing this MPH, you become a global person. You go to USA for one term of 3 weeks. You attend some courses over there and come back. The degree is awarded after you complete practicum and the report is submitted. So in nutshell or in brief, this is what the whole thing about Master of Public Health. The fee for this MPH program, if you go for the same degree at Johns Hopkins, current expenses on tuition and other fee are $73,000. $73,000 plus the living expenses of about $25,000. So it comes around to $1 lakh. The same degree might ask me question why you are not charging that much. But here, this is you have to pay only $22,000, and you get the same degree, same credentials. So it's a great opportunity at the 1/3 of the price, 1/3 of the fees. You get highly coveted world's #1 program, Masters of Public Health. So don't get disheartened. You can make a place for yourself in the professional world, in healthcare, in public health. You can be in the policy, you can be in the strategy, you can be in research, you can be in consulting, you can be in startups and entrepreneur. There are many opportunities that you can create for yourself with your hard work and creativity. Thank you so much. We'll now look forward if you have any questions or queries which need to be, you need answers for them or clarification for them. Okay, it's now open. Questions, they're typing. Okay, where is the question? I don't know. Okay, all these are questions. Can you read?
What is fee for program? What is fee for the program?
The fee for the program is $2,000.
What is major difference between MBA and MBA in health management?
Great. Okay. So MBA Health Management or Hospital Management is again a 2-year program. It is exclusively focused on management. Huge component of public health, especially in health management. So it's a very interesting question, very important question that has been asked. So public health, this Masters of Public Health is focused on public health competencies, as I mentioned earlier. Like data science, epidemiology, biostatistics, climate and environmental health, social and behavioral sciences, health policy and management. These are the competencies. And now, of course, management is primarily for managing health institutions, and hospital management is generally for the hospitals. You can go into research positions, you can go into consulting positions, you can go into project management positions, you can go into specific areas of public health, like health information technology or health information management. You can go into logistics and supply chain management. You can be specialist in monitoring and evaluation. So there are many opportunities that can be. And one very interesting area that has emerged very recently is the implementation science. So there are opportunities for, and then we are also seeing a great thrust on alternate modes of healthcare delivery, mobile health or e-health or digital health. So many intervention programs are going on in order to improve access, availability, and quality of care. The era, the present era is of sustainable development goals. It will be more and more emphasized in future. So there will be a great demand for public health professionals.
The next question is, I am doing MD Community Medicine. Can I pursue this course after completion of my MD?
For sure. Sure you can. When you will be finishing. But for admission to this course, the eligibility is a graduate degree. Graduate could be MBBS or BDS or any other science. They are eligible for this. The other graduates have to do, GRE is requirement and TOEFL is also requirement for them. But graduates from MBBS are exempted from GRE and TOEFL. So MD or no MD, you are eligible for this. Even if you do your MD, you are welcome.
Next question from Madhav Nayak. He is asking, is this course online or residential course?
This is a residential course. You are on the campus at IIHMR, Jaipur, for almost 1 year. We have great hostel facilities, world-class facilities. So you stay in the hostel here, and after completing 1 year, that you complete your coursework, 80 credits or 85 credits we see, then you do your practicum. You can go back to your workplace, you can do your practicum work and submit report of the practicum. Usually you are awarded a degree in next 6 months of completing your course, depends on when do you submit your report. You can go to convocation at Johns Hopkins University in the month of May, or you can come to IIHMR convocation in the month of June. So your degree is then brought from there to Jaipur and awarded to you. The option is yours. If you want to take your degree there, in their convocation, it's like this.
Next question from Dr. Faisal Marhuz. She is asking, does IIHMR offer placement help?
We do facilitate. And in fact, there is a portal that portal at the Johns Hopkins site, and we also have created a portal for job sites. So you have to continuously look for it. And the whole, the trick is this to get a job. We facilitate, we link, we invite people. But the trick of getting a job quickly is to prepare for it right early on when you start your course. Typical Indian mindset is once you finish your course, you wait for finishing the course and then you search for a job, which is not the right way. Now, what do? You have to start preparing for it. You must publish. You must strengthen your credentials and actively explore opportunities to work with organizations and finally get subsumed in them. So we have to prepare right from the beginning of, and yes, we do connect, we try.
The next question is MD versus MPH. How beneficial is it to go for MPH after completing MBBS?
MD is a doctoral degree. MPH is a master's degree. MPH exclusively focuses on public health, especially focused on skills and competencies, whereas MD is an academic degree. So MPH, so this MD generally this is public health or preventive and social medicine, and there is a difference in the content of the degree MD, and I have already shared with you what are the core competency areas in MPH. So we produce public health researchers, administrators, planners, consultants, and likewise. But MD generally focuses on academic development. You become faculty somewhere in management college or something like that.
Next question is about the difference between healthcare management and hospital management. So Amanjot is asking which one is better. And second question is from Aisha. She is asking that could you please tell me how different are the job opportunities between health and hospital administration, which will be required to choose the second year of the course. This is about hospital management.
Okay. That's a totally different domain, and but which one is better? Which one should prefer? This is a matter of choice and liking. What passion you have? Health management opens up vast opportunities. It's all unlimited. But it requires a lot of hard work. It requires at least 5 years after completing your degree to get going in a desired fashion that you want. So you go into management positions in the Government of India, Ministry of Health, or State Departments of Health, or in NGOs, or in private sector healthcare facilities. And these days, this IIHMR Bharat and NRHM, these are the places where, and then there are various national and international organizations, foundations, and trusts that take health management students. Hospital people, they go to the hospital, and then they are limited to hospital. So they are in that four walls of a hospital. So, but if you look at the trajectory of growth, so in the beginning it may be slow in health management, but later on it can really skyrocket. You can achieve whatever you want to achieve. In hospital management, initially it's very nice, glittery, but same repetitive things you keep on doing for next 5-10 years. Finally, you want to develop a new skill or new job profile or something like that. So you have to come back. So it's not sufficient to do MBA hospital management or health management. You have to do further studies. You have to continuously build up your academic knowledge and skills to grow further.
So Tanveen is asking that how does this course is different from MD? So we have explained this question. So second part of his question is, what is the weightage of this certification of this course in global organizations like that?
Same credentials as you get MPH from USA, Johns Hopkins University campus. Same credentials. I would like to share with you, there is a accreditation body, Council for Education in Public Health, CEPH. So it is a CEPH certified which is the body to certify
certification
certification and public health. So that is done by them. So this MPH is also the same. So it is also CEPS certified. So same credentials, go anywhere.
Puneet is asking whether all life sciences graduation can do MPH.
Sure. Yes.
So next question is TOEFL or GRE test score is necessary for MBBS graduate student. So I think this question is clear that
There is no need for GRE and TOEFL. It is exempted in case of MBBS students.
the next question is there any scholarship offered for this program by IIHMR?
We do not offer scholarship as of now because we are already taking 1/3 of the total fee that is charged over there. But we try to help. Like, let me give you some idea of how do we help. So you don't have to pay admission fees of $500. That is waived for you. You don't. We will be. You don't have to pay for GRE and TOEFL another $500. So $1,000 like this. And I'm saying that the $400 which are required for SOFAs and credentialing, IHMR will reimburse it to the students on production of the receipt. And informing us that they have submitted applications to SOFAs, completed application. So SOFAs has to certify this, that the complete application is submitted by the student. So we are supporting with $1,500 almost. I think we cannot do more than this at this point of time.
The next question is from Ganesh Dhumal. He is asking, BHMS student also need to give GRE or TOEFL?
Yes, they are to.
So next question is from Shurvi Kendora. So she's asking that as this university offers degree on both MBA in health and hospital management, and how do we get to show degree in health and hospital management? So I think we have given answer.
Yes, we have, I think, discussed this.
Next question is for admission to MBH, we should have date registration number, DCI registration number, Dental Council of India registration.
For a valid degree, you have to have a registration. It's a prerequisite for a valid degree.
Next question is from Nathan Acharya. So, would you be given an email for the online submission of the form? So, I think this form can be submitted directly by just clicking submit button on the PDF format of the application, pre-screening application now.
So, as I said earlier, this is mph.ihmr.edu. When you open the link, you will see the form, and you will see at the bottom a submit button. Press that button once you have finished.
Now, next question is online consultation be counted in work experience?
There is a thin line, and what type of consultation you have done online. So you submit your application. Let's see how do we help you.
Next question is the degree in MBA HM globally accepted?
MBA?
MBA in HM.
Yes, yes. This is equivalent of any degree, MBA degree anywhere in the world, because this is UGC approved, University Grant Commission.
Next question from Puneet. Which are the top companies in health sector associated with IIHMR?
We are collaborating center of the World Health Organization. We are associated with UNICEF, UNFPA, Price Waterhouse, we are associated with KPMG, McKinsey, Deloitte, and almost all hospitals in this country of worth are all associated with us, the Ministry of Health, various state governments, private sector hospitals and organizations. So huge list, maybe around 150 organizations and agencies which have active working relationship with us.
So next question from Faisal. That is, his work experience is prerequisite for MPH.
What is the background of Faisal?
So he did not show in background.
But if Faisal can give me the background, then I can help.
Next question from Nigam Sadi. She is asking what kind of the work experience is required and encouraged.
I like to say something on how the applications are evaluated. You know, if you look at this SOFAS application, you take a screenshot of this. There are two important things which are necessary. One is the statement of purpose, SOP. And that should reflect your passion. That should reflect your focus. How are you going to achieve? How are you going to fill up your passion? And what you want to achieve finally. That has to be written nicely. We can give some training in writing scope of purpose, or you can go to Google and see some samples of statement of purpose, how to write that. But statement of purpose is very important. Second important thing for in evaluation of application is the references. Who are your references and how they have written recommendation for you. Recommendation like he bears a good moral character is absurd and not accepted. It has to be, so we can put up a sample on our site that how this recommendation letter should be written. So it has to be specific to your skills, and the person who should write your recommendation, one should be your teacher of senior level and the other your employer or someone who knows you in the profession. They should write your recommendations. That is the second thing that we need. A third thing that is being discussed is work experience a prerequisite. Or what type of work experience is required. You know, this health sector is now very wide. So information technology, health information, health technology, or service delivery, or patient care, or survey research, or you know, consulting. All this is counted in work experience. So try to really get that set of work certificate in those areas.
Yeah, the Faisal is telling that he is an MBBS graduate. So I think in this case, work experience is not required.
Or we will manage if you submit application.
So one question is about that application process seems to be very complicated. Do IIHMR helps in completing application? And
we have this in mind because if you look at the SOFAS application, it's quite lengthy. It's simple, but looks lengthy. But we can do hand holding. If you find difficulty, you can call us and we will be very happy to help you out to fill up the form. But my suggestion to you is take a screenshot, collect information, keep that ready, and then start filling up. Half of your problems will be solved. If you have any problem, we will give you a number. Again, which number we can give? There is a toll-free number. You can use the toll-free number given on the website.
In the brochure, there is a number given of our colleague who is supporting.
So you can download the brochure from our website, and there is a helpline number, and you can contact us. Let me show you this. This is MBBS prospectus. At the back of it are the contact addresses, and to whom there is a toll-free number, and there is also a mobile number, and there is a landline number. If you do not find anybody to take and help you, please note down a name, Dr. Mohan Berwa. Dr. Mohan Berwa or Dr. S.D. Gupta. Okay, we'll be very happy to help you in filling up the form. We are going to organize another webinar on completing SOFA's application form very soon. But you first send your pre-screen so that we can evaluate whether you are eligible or not.
Yes. Another question is there any other institution in India which is offering a PhD program with JHU similar to IIHMR?
There is nowhere in the world that JHU program is available except JHU in Baltimore, US. But as I said earlier, there are 44 MPH program in India. They start with 40,000 rupees to 2 lakh rupees. So they are available. The choice is yours. But you want credentials and the brand, then this is the program.
One question is about, is work experience is mandatory for BDS graduates?
Even if you have worked in NGOs, that will also work. But let me confirm this. You can write a mail to Dr. Berwa, and we will respond after confirmation from Hopkins.
One question is, I am Dr. Sanjay, MBBS, did MBBS from India. My question is that, can I apply a job in USA after pursuing this course?
If you want to work in a hospital, then you have to do your USMLE, right? But if you want to apply for any public health job, you can. They will consider. But not for clinical job. It's only public health or health systems related job that you can apply for. Yes, you can.
Yeah. One question is from Tanvi Nair. She is asking, as you are allowing all kind of graduates into the course, what additional scope does this course have for an MBBS graduate in India? What would be the pay scale for a beginner with an MPH degree, and what is the progress one can aim for?
As I said in the beginning, the medical doctors are not coming in public health. So the space is filled by others. But if they are there, they definitely have a greater prospect, and they can contribute more. And they can really create a place for themselves. And not only this, they can raise the level of public health as well as a discipline. So now about pay scales and all that, it depends on whether you are in a government job, you like a government job. Then there is a scale of government, so irrespective of fact whether you are MD or MCH or whatever degree you have, they have a scale. In the private sector, definitely there's a weightage for the degree, weightage for the experience, and your own personal intellectual skills and competencies. So it's not a one fits all kind of business as far as salary is concerned. Salary depends on your ability, your background, your contribution, your credentials.
Puneet is asking whether this course is semester wise or annual or year wise.
This is quarter wise. So we have 3-month term. We call that as quarter. So there are 5 quarters or 5 terms in the first year. And then second year, you do practicum. There is no coursework in the second year. So that is called a 6th term.
Mitsa is asking whether there is a stipend associated with this course.
Not really. Not really. But at the IIHMR University as well as at Johns Hopkins, many research studies and projects keep on going, and depends on the faculty and your interest area. They can hire you as a student support and pay you some money for your work. But as such, university doesn't give any stipend. You can work as a research support or research associate or research assistant and assist faculty in their projects for which you can get paid.
Yes. Next question, Neelam is asking that I want to serve in the rural areas of our country. Will this course will be helpful?
I hope you have heard about I hope you have heard about Dr. Abhay, Dr. Rani Bang, and there are many. They are all MPH and they live in villages and serve them. You will be better equipped with this degree to serve people.
Neelam is also asking, please tell us how to prepare for entrance exams and PIs. I think she is asking about MBBS.
I think Neelam, you are asking about hospital and health management. And for that, you have to write MAT, Management Aptitude Test, and then you have to come for group discussions and personal interview. So you have to follow this procedure. Now, regarding preparing for MAT, go to the Google, and it will tell you what is MAT in India, and you can contact IIHMR, Association of Indian Management Association, All India Association of Management. So go to their website. You will find the test papers for MAT, and in the market you can also find the books on MAT.
Next question is, what are the chances of getting employment in US after completion of this program? I think he is asking about MPH.
I have answered this question. You are treated at par with any MPH in US, and whatever are the job opportunities for any MPH in US, you also have that opportunity. So you are eligible for it.
Next question from Tanvi, is there a collateral free loan available to pursue this course? Collateral free loan.
I do not know what is collateral fee loan, but definitely bank loans may be availed of. We give you testimonials that you can submit to the bank, and the bank can give you a loan on that. Up to 11 lakhs, I think there should not be any problem in the bank.
And Neelam is asking how many seats are available for MPH program.
30.
30 seats. I think all the questions are addressed.
Any other question, please feel free to call on our phone numbers given over there or write to us. Dr. Mohan Berwa, give your email ID, sir.
So my email ID is Mohan, MOHAN, Berwa, BAIRWA, @IIHMR.edu.in.
And my ID is SD Gupta, S for Shimla, D for Delhi, Gupta, SD Gupta, all in a small case, @ihmr.edu.in. So feel free to write if you have more queries, if you need any help in filling up application form or your bill reimbursements or submitting your application, please do contact us. We will also announce someday how to, just to assist you to fill up this SOFAS form. But you, meanwhile, send us the pre-screen, and after that we will see what goes. On your request, we can help you again online to complete SOFAS form.
One more question. What are the job opportunities? This question is addressed.
So I think we have exhausted all the questions.
Yeah.
Yet, if there are more questions, please feel free. Download this brochure, and most of the information is available on eligibility and others. All information which I have said is available. Next webinar on 13th.
Yeah. Dear friends, next webinar will be held on the date 13th, 13 June, right?
May.
Sorry, 13 May.
May
30th May.
13.
1.
Okay, thank you so much for being with us.
Thank you.